Just hours ago, the city of Denver removed several restrictions on needle exchanges. Previously, just 3 facilities were allowed citywide, and they had to be 1,000 feet away from schools.
Well, Denver 7's Daniel Kreuter spoke to the director of the largest needle exchange program in the state about how they think this is going to help.
This unassuming building on the corner of Lincoln and 8th in Denver might just be one of the busiest on the block.
We see about 200 people per morning being proactive about their health.
It's one of 3 locations currently being used as part of the city's needle exchange program.
We served about 5,100 unduplicated folks last year for 27,000 access episodes.
Lisa Rayville is the executive director of the Harm Reduction Action Center, the largest syringe access program in the state.
People have the opportunity to dispose properly of their used syringes, access to sterile syringes.
Organizers say this keeps used needles off the streets, makes sure people using drugs do not use contaminated needles, and gives people access to other opportunities.
Resources with those referrals, on-site service providers, on-site testing, on-site hepatitis C treatment, and also naloxone.
According to the Denver Department of Public Health, people who use syringe access programs like this one are 5 times more likely to also access treatment for substance use. But since 1997, needle exchanges have been limited in Denver. Only 3 are allowed, and they must be 1,000 feet away from schools. Those are the red circles you see here. The green spaces on this map show the areas where facilities could be located if there were no distance restrictions. Community organizers say it's clear there is a need for more locations.
It's an archaic ordinance where we have shown, not only for the last 22 years as an agency, but in the last 13 being heavily regulated. This is a professional organization. Syringe and pipe access programs are needed in the community. We push forward for a healthier and safer Denver.
I'm Danielle Kreuter, Denver 7.
To give you more perspective, New York City opened the nation's first overdose prevention center in 2021. The center says it reversed more than 600 overdoses in its first year and had no deaths. People bring in their own drugs, and staff provide clean syringes and other medical care. Drugpolicy.org says in addition to preventing overdoses, these centers reduce the frequency in which people use drugs. They also reduce HIV and hepatitis C risks.
All right.